a lot of the times I get babies in my office and they haven't been gaining weight, even though mom feels like the baby's been at the breast all day long. And how do we know the difference? We're not teaching these women when they leave the hospital what is a really good definition. We sometimes will say, the baby's at the breast and the baby's hungry enough, the baby will eat, which is so not true. And we want to make sure there's going to be 3 signs I'm going to teach you. One of them is a jaw glide. Now this baby is going to be at the breast doing this nice locomotion movement with their jaw right here. So just imagine some, again, locomotion and those wheels turning and having that rhythm. That is a good breastfeeding suck. The other thing is that we're going to hear it, and this is number 2, is some swallowing. So having this baby do this nice jaw glide with the ka sounds, the swallows, that's how we know that they're swallowing. So it would be more like they're sucking, ka, 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 and then it goes to a nice long deep suck. Ka, 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 ka. Or it will be so just listen for the cuts. So number 1, the locomotion movement right in here. Number 2, you're going to listen for those swallows. Number 3, we need to keep this baby awake. So what happens when a baby is there at the breast? It feels so good next to mom, and mom smells and tastes so good. And once when that baby, some of these babies will get onto the breast and they'll start to suck, and then they'll suck and then they tend to go to sleep. And it's really hard to wake up these babies into a deeper sleep, waking them up from a deep sleep in order to keep sucking. So what we do is we do the 5-second rule. The 5-second rule is, again, when they have fallen asleep and they have not self-started in 5 seconds, we do a few things to wake them up. One of my favorites is the pump you up trick. So we're going to pump up their arm, kind of get some sucking again. The other thing is that what we're going to do is we can rub their heads. We can take them off to burp. Yes, breastfed babies, I feel, in my experience, needs to burp. And so we could wake the baby up to burp again, and then they'll cry and they want to go back to eating, and that's great. We just woke them up. And the other magic of all this to help a baby feed adequately and really well and efficiently is skin to skin. Mom, take off everything, girl. Your husband will not mind. And have the baby take off all the clothes on the baby. And then the baby is just down to a diaper. And have this baby skin to skin at your bare chest. And what that does is it instinctively tells the baby what to do, where to go. They tend to stay awake longer. The studies will say that they actually feed more efficiently when mom and baby are skin to skin. And so all of those things together, you're going to have a good feed. And you're going to know you have a good feed, especially if your nipples don't hurt, and that's our next discussion on another video. But for just to have a really good definition of a feed, we again are looking for that jaw glide. Now, some babies chomp, and they'll do this bite, 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 bite. This baby is not getting a whole lot. Some actually do really well on your overflow, and some women have a lot of milk and doesn't need a lot of great stimulation to have that milk come down. It does happen, and what we don't want to rely on that. We want to make sure this baby's really eating well. So if there's a chomp at every feed, this baby is not going to be able to get, most likely, all of his or her calories at the breast if we're just having that kind of a latch or a sucking issue. So I kind of categorize that as a sucking issue. We also cannot get on to the breast as deep. And so we want to make sure that this baby is getting on as deep as possible to the breast. And And again, that's also going to help with the really good, you'll hear the swallows, you'll hear more sucking, you'll see more sucking of the really good jaw glide. And then you're going to have a baby that's going to gain weight, be a professional pooper. Don't we all want that as moms? So again, pay attention to what your baby's doing. Keep them awake, keep them naked, keep them working. So we don't want them sleeping on the job. We want them to get their feed in so they can gain the weight, and then everything's going to fall into place exactly the way it's supposed to be. So I'm so glad that you are here listening to this video. Look at your baby at the next feed. Pay attention to their cues. Again, just having them there at the breast all day with the little flutter sucks. Baby's not getting much, girls. So we really need to be able to keep this baby awake and be able to do what we need to do in order to feel like we are nourishing our babies in the right way. If this baby isn't getting enough to eat and the baby's not doing that and none of these tricks are working, it is time to possibly call your pediatrician, or again, call a lactation consultant in order to be able to help you, so you know that we're doing everything we can to get more food into the baby. Also, one last trick before I forget, and this works pretty much a lot of the time as well, is that we're going to express some colostrum onto a spoon. And remember that your colostrum really isn't at your nipple. So many women will start to express at their nipple site, and what we're doing is we're just pinching the ducts, the open ducts. So we want to go back at the areola, which I'm not going to demonstrate on video because I don't have my breast pillow to show you, but we want to go right at the areola line, kind of like in this direction, push back against our chest wall and then roll forward. So push back, roll forward. And it's kind of a quick movement with your hand with a spoon underneath to collect all the colostrum. Then we're going to spoon feed the baby. Allow that baby to lick it up. Just sometimes doing that allows the baby to go, oh, hello, there's something good to eat here. Wakes them up, and then you transfer them back to the breast, and there you go. You will have a baby that will stay awake, get enough to eat, and be able to get this little hump of breastfeeding. It's just kind of hard during the first couple of weeks and kind of figuring out our babies. But always feed the baby is the number one rule in breastfeeding. Number two is getting our breast stimulated adequately and enough times. And number three is to bring the baby to the breast. And a baby will go to the breast if the milk is flowing. Just having the baby there, just hanging out, doesn't necessarily make most breast just flow nicely and the baby gets enough to eat that way. And so just want to remind you to keep your baby awake. Listen for those swallows. And again, if we don't hear those swallows, we got a problem. So hopefully that this is enough explanation to be able to help you get over this period. And skin to skin, that is the magic of it all. So, and go feed your baby.